It might not be the best dinner table topic, but your poop has something important to say. Your stool is more than just waste. It's a daily report card from your body. Whether it's shape, color, or frequency, your poop reflects your digestive health, and sometimes more. From the completely normal to the please call your doctor now, this is one gut check you shouldn't ignore. Okay, let's start with the MVP of poop, the healthy kind. We're talking smooth, log-shaped, soft but firm, kind of like a brown banana or a well-cooked hot dog. This perfect poop is a sign that you're getting enough fiber, staying hydrated, and have a happy gut microbiome. Fiber adds bulk and keeps things moving, while water softens everything up for a smooth exit. So, if this sounds like your daily deposit, congrats! You're doing something right. Keep nourishing your body with those good-for-you foods and listen to your body's natural rhythms. Okay, we've all been there. You're feeling kinda full, bloated, like you need to use the bathroom but nothing's happening. That's constipation, my friend, and it's usually characterized by hard, lumpy stools. Picture those little rabbit food pellets. Not exactly the ideal bathroom situation. This can happen when you're not getting enough fiber, not drinking enough water, or even if you're stressed or not moving enough. The good news is constipation is usually temporary. Drink plenty of water and try to squeeze in some exercise, even if it's just a walk around the block. So imagine this. Your poop is thin and pencil-like, almost like it's trying to sneak by unnoticed. That, my friend, could be a sign of a low-fiber diet. Fiber is like the magic ingredient that adds bulk to your stool, helping it move through your digestive system with ease. Occasionally having a thin stool isn't necessarily a cause for alarm, but if it becomes a regular occurrence, it's worth paying attention to. Think fruits, veggies, whole grains, all the good stuff. Let's talk about inflammation, shall we? When your gut is inflamed, it can manifest in your stool as mucus, a soft consistency, and often a foul smell. It's like your body is trying to tell you something's off. Inflammation in the gut can be caused by a variety of factors, from inflammatory bowel diseases like Crohn's disease or ulcerative colitis, to infections or even food sensitivities. If you're experiencing these symptoms, it's essential to talk to a gastroenterologist to determine the underlying cause and get the appropriate treatment. They can help you get to the bottom of things. Managing inflammation can bring relief. We've all been there. The sudden, urgent need for the bathroom, the watery, loose stools. Diarrhea is never fun. Diarrhea can be caused by a whole host of things, like a bacterial or viral infection, food poisoning, certain medications, or even stress. While most cases of diarrhea are short-lived and resolve on their own, it's important to stay hydrated because those frequent trips to the bathroom can take a toll on your body's fluid levels. If your diarrhea persists for more than 2 days, if you have a fever, or if you notice blood in your stool, see a doctor. Alright guys, this next one is definitely a time to pick up the phone and call your doctor. Black, tar-like stool, often described as melena, is a sign of bleeding in your upper gastrointestinal tract. While iron supplements or certain foods like black licorice can sometimes temporarily darken your stool, if you notice a persistent change in color, especially if it's accompanied by other symptoms like abdominal pain, weakness, or dizziness, don't hesitate to seek medical attention immediately. It's important not to ignore this warning sign. White or clay-colored stool is not something to ignore. This pale appearance suggests a lack of bile, which is a digestive fluid produced by your liver that helps break down fats. A blockage in the bile duct, which carries bile from the liver to the small intestine, can cause this. This blockage might be due to gallstones, inflammation, or in more serious cases, even tumors. If you ever notice your stool looking unusually pale, like white or gray clay, it's crucial to get it checked out by a medical professional as soon as possible. Alright, let's be honest, seeing green in the toilet bowl can be a little alarming. But before you panic, know that green stool isn't always a cause for concern. One of the most common reasons for green stool is simply eating a lot of leafy green vegetables like spinach, kale, or broccoli. Another possibility is that your food is moving through your digestive system too quickly, like when you have diarrhea, and the bile doesn't have enough time to break down completely, which can also result in a greenish hue. However, if the green stool persists, or if you have other symptoms like abdominal pain or changes in bowel habits, it's always a good idea to check in with your doctor just to be safe. Okay, seeing blood in the toilet bowl is definitely alarming, but it's important to remember that not all bleeding is a sign of a serious medical emergency. Sometimes, bright red blood in your stool or on the toilet paper can be caused by hemorrhoids, which are swollen blood vessels in the rectum and anus. Increasing your fiber intake, drinking plenty of water, and avoiding straining during bowel movements can help prevent and treat hemorrhoids. However, if you notice persistent rectal bleeding, if the blood is dark red or black, or if you experience other symptoms like abdominal pain or changes in bowel habits, it's essential to see your doctor to rule out any other potential causes. Sometimes your poop can take on a vibrant orange hue. One of the most common culprits behind orange stool is beta-carotene, a pigment found in many orange and yellow fruits and vegetables like carrots, sweet potatoes, and apricots. Your body converts beta-carotene into vitamin A, and any excess can be excreted in your stool, giving it that characteristic orange color. In most cases, orange stool is harmless and nothing to worry about, especially if it's related to your diet. However, if the color change persists or if you have other symptoms, it's always a good idea to check in with your doctor. Yellow is not usually a color you want to see in the toilet bowl. Consistently yellow, greasy, and foul-smelling stool could be a sign of something more serious. One possible cause is fat malabsorption, which occurs when your body isn't properly absorbing fats from your diet. This can be due to conditions that affect the pancreas, liver, or gallbladder, which are all involved in fat digestion. If you're concerned about yellow stool, especially if it's accompanied by other symptoms like abdominal pain, bloating, weight loss, or fatigue, it's essential to consult with your doctor. They can help determine the underlying cause and recommend appropriate treatment options. Food intolerances are surprisingly common and can wreak havoc on your digestive system, and your poop is often the first to know. Unlike food allergies, which involve an immune system response, food intolerances are reactions to specific substances in food that your body has trouble digesting. Lactose intolerance, which involves difficulty digesting the sugar found in dairy products, is a prime example. If you're lactose intolerant and consume dairy, you might experience bloating, gas, diarrhea, or loose stools. Keeping a food diary and tracking your symptoms can be helpful in identifying potential trigger foods. If you suspect you might have a food intolerance, talking to a registered dietitian or allergist can provide guidance on managing your diet and finding relief. So there you have it, the scoop on poop. Your stool isn't just waste, it's wisdom. Not every change is something to panic about, but it is worth paying attention. Early detection starts with awareness, so listen to your gut, literally. Stay curious, stay informed. Subscribe for more science-backed health tips, because knowing your body is the first step to healing it.